This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. What do you think is the commonest concern that women have in an IVF cycle?
Look, I wouldn't say that there's necessarily like one particular type of patient. So very kind of common themes of why they would potentially reach out to the service might be, sometimes it's someone who's feeling anxious about perhaps administering their first ever IVF injection. I know that that's definitely quite like a mental, physical, emotional struggle. Perhaps maybe themselves or their partner may be needle phobic too. And it's just sort of giving them that extra guidance and confidence to actually administer that medication. I've actually had some patients contact me internationally as well from overseas who are looking at doing fertility treatment in Australia as well, and perhaps how to navigate the particular system over here from a healthcare point of view. And also perhaps patients, they've had an egg collection, maybe they've had some bleeding or they've had some post-operative pain, and they're not quite sure whether that's normal or if that's something for them to expect as well. So it's, having that service, just a quick phone call to say, I'm concerned about this. Is this something normal, or is this something that warrants some escalation for, further medical management as well?
Yeah, so that extra support is, I'm sure, valuable at times. I mean, most clinics believe that they do provide that service, but in a busy clinic, some of the production line clinics, I have to be slightly rude. Some clinics, there are the two levels of IVF in Australia generally, the what we call the premium units, who are well staffed, who do provide 24-hour a day, 7-day-a-week service. And then there are the cheaper options. I'd say it's a bit like Qantas business class versus Jetstar. You get to the destination, but it might not be very comfortable on the way. So for those patients who are going through particularly the low-cost services, the level of support just isn't there in the same sort of way. So I'm sure you're getting patients from that particular segment of the market who are feeling rushed and don't know whether they should be asking even questions that could be being answered by the clinic. And your comment earlier about patients not absorbing everything that's said to them, and that's something that we as doctors struggle with all the time. That you can talk through a whole IVF cycle with them, spend half an hour, but the psychologists tell us that probably after the first 4 or 5 sentences it becomes a bit of a blur. So being able to find someone to fill in that gap, because they also may feel embarrassed to be actually asked at the clinic because you've been told this already. What are you ringing me for?
You've completely raised a really good point. A lot of times in the clinic, as you were saying, like particularly in the sort of public sort of space, patients have like very kind of limited time frames. So they'll perhaps potentially see the fertility specialist, potentially like a month, and then they'll actually come through for their treatment, and they might only have perhaps maybe 20 or 30 minutes with the nurse. And then that's it. They've picked up their medications, they've done the first one, and then they're off on their own until they have the next blood test and the ultrasound. That's not to say that that's a bad model. That's just the constraints of the system there. But again, it's just, providing patients with that access to have that ongoing clinical support to make sure that they are administering medications correctly.
Yeah.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.